welcome to Menopause Rescue. I'm Dr. Polly Watson. Midlife women are often caught up in a sea of symptoms. Too often, they're overwhelmed by the lack of support from mainstream healthcare. They're inundated with so-called experts who are selling solutions which may lack credibility. I'm a Menopause Society certified gynecologist with both traditional and functional medicine training. I'm here to guide you through this transition and help you decipher the facts from the fads. Armed with credible information, I hope you are empowered to rescue and restore your health, making the second half of your life your best. Welcome to Menopause Rescue. I'm your host, Dr. Polly Watson, and today I'm so excited to have with me Kate Willis, who is such a valuable part of our team. We are going to be talking about supplements, and so many times women come into our office with garbage bags full of supplements, and sometimes they may be taking great stuff, and oftentimes it's not so great stuff. So we're going to really emphasize things today that we are pulling out and recommending again and again. And I'm just going to let Kate start off first, like kind of things she uses a lot.
First, a little just sort of general about supplements. Quality does matter. And so I think, whatever you're picking, hopefully it is tailored to you. It's something that your body's really going to benefit from. But I would just stress that, make sure you're buying from a place that is keeping supplements temperature controlled. They're not getting too hot in a warehouse or a truck somewhere. You want to make sure that supplements are third party tested, meaning someone else is verifying that what's in the supplement is actually what's in the supplement. It's scary how that sometimes doesn't happen. So just make sure the quality is good. There are some other things that you may have to add about that, Dr. Watson. But I would love for people to make sure that they're paying attention to supplement quality too.
Absolutely. And we don't generally advise people buy supplements on Amazon because sometimes there is some counterfeiting. So, a lot of what I take is white powder in a capsule, right? And so how do I know that someone doesn't have a really good Xerox machine and they're putting cornstarch in a capsule and they're selling that to me and telling me this is really $100 bottle probiotic, right? How am I going to know?
Yeah.
So we use a company called Fullscripts. They monitor the kind of a chain of custody from the manufacturer to your front door. So we're not worried about any counterfeiting. And, you just want to make sure you know where you're getting your supplements from.
Yeah, absolutely. So I will jump in with one of my favorite supplements that I am using with so many patients in different seasons of life, in different stages of hormonal seasons of life, reproductive years, things like PCOS, perimenopause, menopause. And that's magnesium. So, magnesium has a lot of different forms that it comes in for oral supplementation. And there are some other ways to get magnesium as well, but I'm going to focus on those oral supplements. We have things like magnesium glycinate, we have magnesium citrate, we have magnesium threonate. Those are three common ones that I'm using in practice. Some of the benefits include sleep support. So magnesium is very relaxing. And so if someone's having trouble sleeping, and I would argue, most people probably need magnesium because our soil is pretty deficient these days. Some magnesium glycinate can be a really great place to start. It's gentle. It doesn't have a big impact on the tummy like other forms of magnesium might have. So it's pretty well tolerated. And it just is very calming to the nervous system, supports GABA production, which is that neurotransmitter that makes us feel nice and calm. So that's a really great one to bring in. Think about the sleep changes that happen during perimenopause and menopause. This is a really great way to be supporting restful sleep. We also know it plays a role in mood. And so if someone's dealing with things like irritability or depression or anxiety, magnesium can be a nice part of their treatment plan. Again, very well tolerated. And it has some neuromodulating properties too. And so it can be really supportive for the whole HPA, that brain, adrenal, pituitary axis. So that can be a really nice thing to add there as well. One thing to add here is that we see a lot of deficiency because chronic stress really consumes our magnesium. And so when we think about even what happens to our nervous systems during perimenopause and menopause, we tend to be less resilient to stress. And so this is a time when extra magnesium can be super beneficial. It's also depleted by things like diuretics. So if you're on a diuretic for blood pressure or another reason, that might be wasting some of your magnesium. If you're on a proton pump inhibitor or another medication that's affecting the acid level in your stomach, that can mean maybe you're not absorbing the magnesium that you are getting through food. So, great thing to add for sleep, mood, and anxiety. I would also add blood sugar regulation. So, again, we think about common things that happen during perimenopause and menopause. We tend to get more insulin resistant. Magnesium really supports insulin sensitivity. It helps level out blood sugar spikes, and it can really even blunt cravings in some way as well. So, big use in perimenopause and menopause. And then I would add the last thing is bone health. We think a lot about calcium for bone health and vitamin D, but magnesium is actually really essential for good bone density in perimenopause, menopause, and beyond. It is an important cofactor for all the other things that help make our bones strong. And so, sleep, mood, anxiety, bones, blood sugar, magnesium is good for just about everything.
And like 78 Americans are mag deficient,
Mm-hmm.
right? So our patient population is typically eating plenty of vegetables, but like you mentioned, the soil is so depleted and nobody's perfect, right? Like, would it be great if I was getting all my vegetables grown from a local organic farmer? Sometimes I pick up a bag of broccoli at Costco because I'm a working mom and that's what I can get together at that point. And so, yeah, a lot of us are low. So that's so helpful. Magnesium is fantastic. You talked about mag glycinate being a little bit easier on people's stomachs. Do you want to talk a little bit about mag Threonate? I know you mentioned that earlier.
Yes. So it is especially helpful when we're talking about the brain. So if there is anxiety or if there's, if we want it to cross the blood-brain barrier, some people feel like it really works better for sleep. I don't know if you're using it more for sleep than mag glycinate, but it can be particularly helpful for that. And then that, general mood support, I'm often reaching for Threonate. Migraine headaches, I didn't mention, but that's another reason we like to pull in magnesium as well. And that's where that Threonate form can be really, really beneficial. Talking about citrate, I didn't follow up on that form, but that's a form that actually is less well absorbed. You can still get some of that good magnesium benefit from taking citrate, but I'm usually reaching for citrate if someone is dealing with constipation or for just trying to help support regular bowel movements. That can be a really great form. Can cause loose stools if taken by some people or if taken in a large amount, but certainly has a great role when we're needing some extra support for the gut and for bowel movements.
And we dose mag to bowel tolerance, right? So one pill of magnesium may have 120, 140 milligrams of magnesium in it. And oftentimes people are needing 400, 600 even. And so you don't start at 600, right? Because like particularly with mag citrate, that's like diarrhea coming at you and abdominal cramping. Like who wants that? So we usually kind of start low and work up slow. But if you're taking magnesium and you increase your dose and you have diarrhea, well, then that lets you know that was a little bit too much. So you need to kind of dial back a little bit. So that's what we mean when we say we dose to bowel tolerance. Okay, so I'm going to kind of segue off of something that Kate kind of built on with the magnesium about bone health. We are often prescribing vitamin D3 with K2 for bone health. And we kind of want to explain this a little bit because a lot of people will be getting a vitamin D level at their primary care, their vitamin D is low, and they're giving these monster doses of vitamin D at once. And the thing that we get concerned about when that is prescribed in that manner is that when you take a huge dose of vitamin D, you're going to absorb a lot of calcium at once, but you can only absorb so much, right? You can only absorb about 400 milligrams of calcium at a time. So what doesn't get put into your body can get precipitated on the inside of your blood vessels. So we don't want to precipitate out extra calcium. It calcifies the inside of our blood vessels and makes these rigid blood vessels that then looks like high blood pressure, right? Or cardiovascular disease. So we're kind of doing slow and steady rinse the race with vitamin D, thinking about 2,000 international units, 5,000 international units, but combining that with K2, which is then helping the calcium get into the skeleton. And then it gets even a little bit more specific with that. So of K2, there's something called MK4 and MK7. There are two different formulations of that. And there's been a lot of Japanese research that has shown that the MK4 version of K2 is better for, has better data for fracture prevention than the MK7 version. And it's a little bit of a pain in the butt because the MK7 version is one, much more widely available, but two, stays in your system longer. The MK4 version of vitamin K2 needs to be taken twice a day. And so we can drop this in the show notes. There are some products that have, let's say, 2,000 IUs of D3 with maybe 100 micrograms of MK4 version of K2, but you would have to take it twice a day, which a lot of us, myself included, have a hard time hitting the supplements twice a day. But I think when people are taking vitamin D, we want them to know not to take these mega doses, to always combine D3 with K2, and then the type of K2 also really matters. So Kate, you had also talked about insulin resistance. So do you want to kind of talk about berberine for insulin resistance? Because I know that's one we use a lot.
It is. Berberine is a plant product. And so we're using this plant product in usually a capsule form for insulin sensitizing. So one of the things I mentioned that we see pretty often in perimenopause and menopause is increasing insulin resistance, where our cells are demanding more insulin to get blood glucose into cells. So, berberine actually works fairly similar to a pharmaceutical called metformin, but maybe has some benefits in terms of not depleting some nutrients that metformin can deplete. So, it's a great product to use, and it helps with that sort of blood sugar, insulin resistance. It even has an effect on cholesterol levels, which often is going hand in hand with those changes that we see in insulin and blood sugar during menopause. We sometimes reach for it for weight management. And I would say, I'd love to hear your 2 cents on this as well. I don't see it being the big needle mover for weight that we would like it to be. I do think it can help, again, shift that insulin resistance piece of things, and that may set someone up for the ability to lose weight, whereas it was more difficult before. But I would say that berberine by itself isn't usually leading to weight loss in the absence of other changes and other interventions. Is that what you're finding as well?
Yeah, I completely agree with you. And I think that maybe a good kind of take home to put in is that when you're working in functional medicine, all of these supplements are in conjunction with healthy diet, healthy lifestyle, sleep, stress management, resistance training, all of those things. And so you can never out supplement an unhealthy lifestyle, right? So berberine is never going to push the needle if we're eating highly processed food, if we don't move our bodies, all those things. It's just another tool in your toolkit, like you said, that can help move the needle, but it's not going to cause weight loss like a GLP medicine or something like that.
No. And I think depending on where you live in the social media world, I think there have been some people who've really touted berberine as like nature's GLP-1. And I would say berberine is great. I love berberine. I recommend it a lot. It is not going to do what a GLP-1 injectable medication does for weight loss. I think just knowing that and having realistic expectations about what it does and doesn't do. One other cool thing about berberine is it has some natural antimicrobial properties. So, there's a big connection between the gut and metabolism and the gut and our own endogenous production of GLP-1. I think this is where some people have taken that and run with it when it comes to berberine. But berberine does play a role in the gut health, and it plays a role in modulating the microbiome and even, modulating how we clear estrogen from our gut. So we can absolutely pull berberine in appropriately for metabolic health, for the gut microbiome. And then we're even using it with younger patients who have PCOS and might have insulin resistance there. So certainly use it in perimenopause and menopause, but also use it with younger patients who have insulin resistance or PCOS.
Yeah, and can you talk a little bit about side effects with berberine? Because I do think it's another one of those start low and work up slow ones.
Yes, yes. It can be tough on the gut. And so I usually have people take it with food just to make sure that they're tolerating it from a GI standpoint. And I yes, usually start people really low. I usually tell people to start with just one capsule, and sometimes we'll work up to two or sometimes more than two, depending on what our goals are. But we really do want to be careful that we're not causing GI upset. And I find that people really acclimate to it. So sometimes being on a lower dose allows a higher dose without any GI disruption later on.
And I just kind of want to point out, because this is a podcast and we're not giving medical advice, but just as an educational thing, berberines can affect statin metabolism, so they can potentiate the action of a statin. So you don't want to just, if you're on a pharmaceutical like a statin, you don't want to just start berberine without communicating with a healthcare provider that prescribed that statin, because there is a pretty common interaction there.
Yeah. Thanks for bringing that up.
So, I'm going to talk a little bit about broccoli sprouts and why we might use those. And like Kate is saying, a lot of these things we're using at different stages in the hormonal journey, right? So, broccoli sprouts have 500 times more sulforaphane than broccoli. Sulforaphane helps us detoxify estrogens. So, we might pull on this when someone's really estrogen dominant. So you think about that with PCOS or with PMS or with perimenopause, conditions like fibroids, heavy bleeding, breast pain, all of those things are sort of estrogen dominant conditions. And so I like to have people grow broccoli sprouts and just eat them. Mama, HAMAMA, is a company that sells these little seed mats. So they're really easy. You can drop them in a glass Pyrex casserole dish, fill it up with water, put it on your counter, and 10 days later, you have broccoli sprouts. I personally think that's easier than constantly going back and forth to the store, because they're really expensive at the store and they rot very quickly. But you're kind of going for like a 4 inch by 4 inch square of broccoli sprouts a day. And you're just kind of picking up their little heads and snipping them off, running them under the sink and washing them out. I put them in a smoothie. You could put them in salads. I sneak them in my kids' smoothie all the time just to give them extra vegetables. But broccoli sprouts are sulforaphane. So sulforaphane is helping us detoxify estrogen. It's also really great antioxidant support, anti-inflammatory support. So it's kind of a superfood, right? Broccoli sprouts are a superfood.
Yeah, absolutely. And, if we're in this sort of perimenopause stage where we're getting wildly fluctuating estrogen, our estrogen is going really high sometimes, making sure that we're doing everything that we can to appropriately detoxify that estrogen can help buffer some of the symptoms that come with high estrogen. And then if we're, giving hormone therapy in perimenopause or menopause, making sure that that individual is really clearing their estrogen efficiently. Broccoli sprouts, I think, are a yummy way to do that. I think they taste good.
Awesome. So, Kate, great segue, because broccoli sprouts are really helpful for inflammation. And you were going to talk a little bit about omega-3 fatty acids, which are also really great for inflammation.
Yes.
So, take it away on that one.
Yes. Again, I'm going to just go back to what happens physiologically during perimenopause and menopause is that we tend to have more systemic inflammation. I would argue that omega-3 fatty acids are probably great for people at all different stages of life. And we, use them in kids who have maybe ADHD or other neurological issues. But I think perimenopause and menopause are a really great time to bring them in. we think about systemic anti-inflammatory effects. So joint pain, cardiovascular health, even metabolic health. These play actually a big role in reducing triglycerides. And so, that whole gamut of things that are coming in perimenopause and menopause in our heart and in our joints and then even in our brain, for mood support and for lowering that brain inflammation, these can be really, really great.
Yeah, I like them, and I think sometimes people feel like they're not working, and then when I look at what they bring in, I think the biggest mistake I see is people aren't taking enough.
Yes.
So, I would generally think like you need 2 grams of high quality fish oil a day.
Yeah.
I know we use a lot of Nordic naturals. I think a lot of people are concerned about getting fish burps.
Mm-hmm.
My kids bite the Nordic natural capsule
Oh,
and just
wow.
eat it. So it actually is so pure, it doesn't taste fishy at all.
Yes. Yes.
And I will tell you, again, busy mom, we all sometimes push the easy button. One time we were out of Nordic Naturals, so I just grabbed some fish oil from Costco and the kids bit into it. And you should have seen their
Oh,
little
no.
faces. They were just like, this is disgusting. What is this? So there is really a huge difference in quality that,
Yes.
like you say, with brain health, I just kind of wanted to emphasize that there are studies that have shown that adding fish oil to an antidepressant can make the same dose of antidepressant work better.
Mm-hmm.
And so our brains need fat, and a lot of us are struggling with, elderly parents and launching kids and career issues. Many of us may be on antidepressants, but we
Mm-hmm.
might be struggling with some of the side effects. And so it's really important to know, hey, here's something maybe natural you can add to that before seeing if you need to actually go up on your dose, because that
Yes.
might help moderate some of those side effects.
Absolutely. And often when I'm treating a very, very clear sign of inflammation, maybe we have an elevated what's called C-reactive protein, which is a marker of systemic inflammation. If that's elevated, or if someone has clearly really elevated triglycerides, and I would add, like you said, for mood, if we're really trying to target that, I'm often trying to reach for at least 3 grams combined EPA and DHA for more maximum effect. Also, we're kind of looking at the diet too. And if someone is having a diet that's maybe a little too high in processed food or omega-6 fatty acids, we might even want to be more generous with the omega-3 fatty acids as well. You know, these are really important for all of our cell membranes. And I think fortunately, we're not in the era of low fat everything anymore. But we want healthy fats to be really supporting those cell membranes. We want the hormones that we have in our bodies and the cells that we have in our bodies to be really well supported. And so this has such a wide reaching effect from, inflammatory support to mood support, to cardiovascular health support, to cell membrane support. I love some fish oil.
And I just wanted to throw out like you can get a BPA free can of skinned sardines in olive oil, and that's about 1,200 milligrams of omega-3 fatty acids. So that is one way that you can get it. When you're thinking about fatty fish, you always want wild caught fish, not farmed fish. So the quality of the fat that the animal makes is directly related to what it's fed. So but sardines, if you don't have histamine intolerance and you don't have a problem with canned fish or, tinned fish, that would be a way you can get some through your diet.
Mm-hmm.
We need omega-3s to make something called pro-resolvin mediators. And it's another way to help with inflammation. And a lot of us, as estrogen goes down or is fluctuating in perimenopause, a lot of us are feeling very inflamed. I think this is also just in this kind of post-COVID world, we're seeing a lot of long COVID, which is another persistently inflamed state. We're often using a lot of pro-resolvin mediators in that constellation of inflammatory systems also. Pro-resolvin mediators, Metagenics makes one called SMP Active. Pure Encapsulations makes one called, I believe it's Pro-Resolve Omega. But that can be in addition to your fish oil to help really extinguish inflammation. And so we use them a lot if someone had surgery, if they had a viral illness. I will use them a lot after someone's had COVID or anything that's kicked up inflammation. They've had a breast biopsy, whatever, or they just have that everything hurts, right? So that's just another tool to have in your toolkit. When we're thinking about inflammation, we need omega-3 fatty acids to make pro-resolvin mediators. And sometimes we want to add a little bit extra in the form of a supplement.
Yeah.
All right. Now you're going to talk about my favorite one.
Might be my favorite too.
We saved the best for last.
Yes. I'm going to talk about something called L-theanine. And L-theanine is a component in green tea. And this is part of why even caffeinated green tea doesn't make you feel as stimulated as a cup of coffee does. L-theanine has this really calming effect on our nervous system. Okay, so how do we use it in menopause and in perimenopause? So anxiety and mood regulation is up there. This was something that I had during the pandemic, just constantly beside me. It's not sedating, so it doesn't make you feel tired or knocked out or like you need to lie down and take a nap. I almost say it helps with like just that busy brain where your brain is all over the place. You can't focus. You feel a little anxious and edgy. Just kind of calms things down so that we can even use this for women who are struggling with ADHD symptoms in perimenopause. This is so great for focus and calm. I use it a lot for sleep support. Again, especially when that busy brain is part of why a woman is having trouble falling asleep or staying asleep. We can use it at bedtime if sleep initiation is really the issue. But the cool thing is you can even take it in the middle of the night. If you wake up at 2 or 3 or 4, because it does not cause drowsiness, it will often just help your brain quiet back down. So I'll recommend keeping it, in a place where you can easily reach it without turning on a lot of lights. You can put your hands on it. And if you wake up and feel like you can't go back to sleep, just taking 1 or 2 capsules, depending on your dosage, and just putting your head back down on the pillow. And most people will fall back asleep and at least get some restful sleep before the night's over. So it can be really great for waking up in the middle of the night, and you don't want to take something that's going to make you feel very sedated, 2 or 3 hours later.
Yeah, it's L-theanine gets in our system in about 20 or 30 minutes.
Mm-hmm.
And it's out of our system in about 3 or 4 hours. So I totally love that. 3:00 in the morning, I got to be at the gym at 6. So I think another thing I see when people are like, I'm taking L-theanine, it's not working. If I read the back of the pill bottle they've got like 50 milligrams.
Mm-hmm.
So usually we're trying to get people to take about 400 milligrams.
Yes.
And you could do that 3-4 times a day, right?
Yes.
So you could take it if you have busy mind when you're trying to go to sleep, and then again at 3:00 in the morning, you're not going to hurt yourself. It's a piece of a protein. It's not habit forming or dangerous in any way.
No. And there are some Japanese studies that apparently may suggest that there's no upper limit of normal. I do try to usually give patients you can take this much in a 24-hour period. But all that to say is this is a very safe supplement. It has really few side effects. I've had a few patients that have had maybe some GI side effects from it. That I find that pretty rare, and find this almost universally helpful for people for anxiety, mood, sleep, focus, brain fog, those sorts of things.
Yeah. And I just wanted to kind of clarify. So comes from green tea, but it does not have any caffeine in it.
Correct. Yeah.
So we're not giving anything with caffeine in it at all. And it's, I think it's sort of fantastic when you have to have a difficult conversation. You need to get in your frontal lobe and out of your limbic system and just calm down and be rational. And, in-laws are coming in town, whatever your trigger is, this can be another tool in your toolkit. You might even try it if you have anxiety about flying, right? This would be a time that maybe you could get away with some L-theanine and avoid taking a pharmaceutical.
Yes. And as you mentioned earlier, this is going to work better if you are actively also working on some relaxation techniques or some stress management techniques. So I find that sometimes L-theanine for people lets them get into a state so that they can implement the tools that they know and have on hand. I know if my kids are acting up, I know what I'm supposed to do and I know the tools I'm supposed to bring in. And something like L-theanine, especially if I'm having an off day or just feeling a little rattled in general, L-theanine can help sort of give me that little step up so that I can implement then the tools that I know and have developed and worked on to stay calm and to support myself and to make my family run well. So, yeah.
Yeah, I mean, we all, knowing and doing are two separate things. And sometimes just having a little bit of fog getting cleared so that you can, like you say, access the tools you have and you've developed. We all need that sometimes. And so, anyway, we both use a lot of L-theanine. So, I hope this has been super helpful. I love, Kate, you're sharing your wisdom with us. And if you live in the state of North Carolina, Kate has openings in her schedule. And so we will link in the show notes ways that you can connect with Kate and become her patient, because she has availability and an enormous amount of wisdom and support to share with you.
Thanks for having me.
Thanks for listening to Menopause Rescue. We hope you've enjoyed this podcast and it helps you create some time and space to make this the best half of your life. If you've enjoyed this content, please leave us a 5-star rating and review. This helps other listeners find this resource and rescue and restore their health. If you enjoyed this topic and want to learn more, check out our resource guide for this episode. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time. If you're looking for a menopause expert and live in North Carolina, take our free online class and see if we're a match for your needs. It's called Are We a Good Fit? And is a quick and easy way to learn more about our practice and what it has to offer. Hey, this is Dr. Watson. This is just a friendly reminder that this podcast is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed, and any information you get from this podcast is considered educational only. You should make medical decisions with your healthcare provider. The content of this podcast is not intended to be a substitute for professional medical advice. Listeners should not disregard or delay in obtaining medical advice for any medical condition, and they should seek assistance from their healthcare professionals.